Hello team, my name is Sean Hensler and I am the inventor of the Hensler bone press. And today I wanted to go over the cervical applications of the device as it pertains to the regulations with which we need to abide by dealing with emergent cases only. So the cervical spine is obviously always going to be both taken care of in both an emergent and non-emergent fashion. Most of you know about it in a non-emergent fashion, microdiscs, degenerative disc disease, things like that. But emergent cases such as subluxations, new disc herniations with cord compression resulting in myellar radiculopathy, things like that. These are emergent cases that the bone press could be used on for sure in the cervical spine. From the anterior aspect, doing a corpectomy of the cervical spine is generally done. Even a partial corpectomy to take the pressure off of the spinal cord, specifically the thecal sac. So that could be a combination of bone spurring, OPLL, which is ossification of the posterior longitudinal ligament. That can be a very hard structure, usually found in older patients. And these combining factors can cause cord compression and increased pain and radiculopathy. What makes it emergent is when it becomes a neurologic decline. And in those conditions, the cervical spine needs to be operated on generally and, of course, as per the surgeon. But when the case is taken care of for these conditions, more times than not, a partial or full corpectomy is needed, and the bone press can be used for this. Not only will it collect bone, but when you're doing a partial or full corpectomy, it will collect cancellous bone, the bone marrow itself, which is rich in stem cells, mesenchymal cells, growth factors, BMPs, all those wonderful things we need for fusion. So for these cases, it's important that we know that the device can be used emergently in the cervical spine for a multitude of cases on an emergent basis. Trauma, subluxation, and even for the posterior cervical spine when decompression is needed. Let's say an elderly patient falls and they have T2 signal change in the spinal cord and there's compression and it just needs a decompression. So potentially the spinal surgeon may recommend a posterior cervical decompression. So by undergoing a laminectomy, collecting the bone off the lower spinous process and the lamina, that will serve as a significant source for autograft. Of course, they'll remove the interspinous ligament and the tips of the spinous processes, and the lamina is not as thick in the cervical spine as it is in the lumbar. But these are cases, again, the bone press can be used in an emergent case. Patients can come in with existing hardware and they have to go down in addition. The surgeon has to do an additional level from the front. Now they have a 4-level plate. They're probably going to flip the patient over and back them up with lateral mass screws. If that occurs, the bone that's collected from the front, as there will be extra, you can use it in the back as long as you're in the same case, the patient doesn't leave the room, and the area remains sterile, which typically happens during the flip from an anterior to a posterior approach. So I wanted to share these things so it can be maybe a learning process or maybe a tool that you can use to push the Hensler bone press to not only benefit the patient with their own autograft, their own bone, their own material, it also of course mixes well with bone alternatives, bone scaffolding, DBM, synthetics, as these bone alternatives are typically only osteoconductive. By adding the bone press bone, you're going to be adding the 3 O's, so now you're going to make that osteoconductive material osteoinductive. So you're going to increase your fusion mass. You won't need as much, but it will be a cost savings and it will give you the fusion you desire. Anyway, I wanted to share that with you, and I hope you all are staying safe, and I look forward to our next talk tomorrow, where I'll be going over the lumbar spine specifically. Thank you guys, be safe, and go local. Thank you.